I'm Byrne, President and Founder of Wolf Medical Systems. Today I'd like to take you on a tour of my medical practice and show you how we've deployed Sunray technology and Wolf Medical Systems. Come on in. Our software brand promise is simply powerful. The Sunrays fit absolutely with that brand promise. Physicians today often have up to 2,000 patients. With those 2,000 patients, they have close to 1 million points of data that they're tracking. Their EMR needs to be simple so that they can focus on patient care, and it needs to be powerful so that it can report on all the data that they're tracking. With the Sunrays, we find the same thing. We've got a device that allows physicians to focus on their patients. It's absolutely simple to use and is incredibly powerful when it's deployed. Take, for example, I'm in an examination room with a patient and I need to prescribe a medication. To log out, I simply pull my card and I'm logged out of the system. I can get up now and go to the drug cupboard with my system on my card. As I go to the drug cupboard, I can put my card into the system and log in simply. Check my cupboard for the samples. If I don't have the sample, I can prescribe back on the system. No logging in, no logging out. Come back to the examination room, see the patient. I've got everything recorded as I go. What we find is that 60 to 70% of the devices that we deploy now in Wolf clinics are Sunrays. And the reason for that is everybody who's mobile within a clinic finds the benefit of being able to carry their session with them on the card. No logging in, no logging out. We estimate in our clinic here that we've saved 15 to 20 minutes per doctor per day. The savings when you add them up are absolutely huge. At Wolf, we've been using Sunrays now for over 2 years. We were initially introduced to Sunrays by one of our clients, Ferdinand Legaspi, the IT director of South Calgary Primary Care Network, introduced us to the Sunray technology as they began to deploy Sunrays and Wolf. We quickly learned that the Sunrays were a huge benefit to the doctors and staff, and we built that technology into our data center so that now 60 to 70% of the devices that we deploy and close to 1,000 Sunrays have been deployed across Western Canada with Wolf systems. Another one of the key benefits of the Sunray technology is the fact that they are a thin client and nothing is stored on site. What I mean by that is there's no server here. The data for the software runs from our data center. This device connects directly to our data center and there's no software running on it. So if I pull the card out, I'm logged out of the system. If I put the card in, it instantly logs me back into the data center. One of the other key benefits with Sunray technology and our Wolf ASP is the fact that you don't require any IT support on site. Sunrays connect directly to the data center and there are no updates to be done. Everything's done automatically with the technology. In our office, we've deployed the Sunrays wherever physicians work so that we can use them in our office, in our hallway workstations, in our exam rooms, in our surgery room, and even in our nursing station. Wherever a physician works, wherever a physician goes, we have a Sunray deployed so that the chart can follow the doctor. The doctor doesn't have to chase the chart. Prior to adopting the Sunrays, my personal preference was to carry a laptop wirelessly and go from room to room because I love to have the context of the patient chart in my hands. Since switching to the Sunray, I get all the benefit of having that patient context follow me, except now it follows me on a card that's a lot lighter than a 3-pound laptop.